still don't have definitive proof that resistance to heartworm preventives exists. We certainly have empirical evidence that makes us suspect that. We have some preliminary studies that make us consider the possibility, but we don't have anything definitive yet. I know that studies are ongoing, and I would suspect that in the next month to 2 years or so, we'll know a whole lot more than we know now. But with respect to LOEs, we still don't have definitive information about that subject. And then I guess the next really big issue to discuss is the imidacide shortage, and it's a really unfortunate thing because as our 2010 incidence map showed, that although a generally dry year tends to concentrate the cases, I don't think that we're seeing really diminished numbers of cases of heartworm, and we're seeing cases pretty much throughout the United States. So vigilance on the part of veterinarians and pet owners on prevention, 12 months and testing every 12 months is going to be and continue to be really, really important. And then the last thing is the imidacide issue. And, I don't understand the complexities of the manufacture of that drug. I just understand that it is a very complex and highly regulated process, and that problems have occurred, and that's put us in a real bind. The American Heartworm Society has responded to that with a nice plan. And that plan appears on our website. It is obviously a compromise. It's not how we would prefer to deal with heartworm-positive dogs, but our preferred method of doing that is not available to us now, so this is the next best thing. And it gives veterinarians a way to manage these cases, hopefully, until the imidacide becomes fully available again. It is available on a limited basis now, and hopefully it will become fully available in the not-too-distant future, but I have no idea when that will be. Let me just say what the primary goals of that management plan are. The management plan seeks to reduce potential pathology from the infection. The management plan helps the veterinarian and the pet owner to try to maintain the health of the dog until it can be appropriately treated. It tries to prevent additional heartworm infection in the dog, and it tries to reduce the infective potential of the infected dog. So those are the four primary purposes of that plan.
Dr. Graham, were you getting a lot of questions, I guess, when the imidacide shortage became apparent that it was happening?
Well, we actually, when it occurred, I mean, we got news right away that something difficult was about to occur, and so we put together the plan pretty quickly after that to try to anticipate the questions that we would have. And we've had a few questions about the plan. We've had more, the questions that have come through our website that I have, when it's my turn to field those questions, most of those questions have come not from veterinarians but from pet owners, and frankly just expressing frustration at the situation. And, and I certainly understand and appreciate that, but, there's really nothing that the American Heartworm Society can do other than to help veterinarians and pet owners